All right. Welcome into Wellness Wednesday. My name is Claire, and on behalf of the CR Pride Fest Board, I want to welcome you. Today, I am talking with Wendy Stokesbary. She is a counselor with Kingston Therapy Services, and we're going to do a little presentation today on Mental Health 101. Thank you for joining me, Wendy.
You bet.
I'm very excited for our conversations. Why don't you tell us a little bit about yourself?
Absolutely. Thanks for having me. I'm really happy to be part of this event for Cedar Rapids Pride. As Claire mentioned, I'm Wendy Stokesbary, and I'm a licensed mental health counselor here in Cedar Rapids. And I work at an office called Kingston Therapy Services. I see pretty much all ages at my practice and treat mood disorders, chronic mental illness, as well as situational stressors, relationship concerns, and also trauma. And I am trained to provide eye movement desensitization and reprocessing, or EMDR, which is a very good therapy for trauma. I'm also trained in parent-child interaction therapy, or PCIT, which helps with little ones who have disruptive behaviors and helps their caretakers to better manage those behaviors. And I have developed a very strong interest in providing mental health care that is holistic, and particularly in treating individuals who have been exposed to trauma. We really do see that just talking, just the traditional talk therapy and cognitive behavioral therapy, which is evidence-based and a very good type of therapy, is not enough to heal when people have been exposed to toxic stress or traumatic events. So because of that, I completed training in yoga teacher training this last fall. And also in taking EMDR training, I've learned that the brain and the body have a lot to do with how we feel. So I am very much an advocate for mindfulness practices and mind-body practices that help to soothe the nervous system, because that helps a great deal with emotional distress. That's a little bit about the direction of my practice.
All right. Well, can you tell us a little bit about some of the basics of what you do as far as, or the mental health basics?
Yes, yeah. So I very much like to use the biopsychosocial model in terms of understanding mental health. And we can think about this in terms of our own overall health, really getting back to the mind-body connection. It doesn't do us any good to separate mental health and physical well-being because they both affect each other so much. So the psychosocial model helps us to see the whole big picture, including the environment. So biology is what you're born with. And these are messages that I send to my clients and help them to understand, because it helps to validate that a lot of the components that go into determining if you're mentally well or mentally ill are beyond your control. And
Right.
clearly that's biology and what you inherit DNA-wise, right? And psychology refers to, or the psycho part of biopsychosocial refers to your psychology or personality. Why this is important is because we find that certain personality traits, for instance, perfectionism, or having a really strong focus on what other people think of you or how they judge you, when you care too much about what the outside world is expecting from you, those kinds of personality traits can lead to more anxiety, for instance. So personality, temperament are all really important in terms of understanding your mental wellness, and also has implications for treatment and for change. And then finally, and the part that is really most pressing for people in the GLBT community is the social context. So we know that environmental factors and pressures add to our stress level. And again, these are things that oftentimes we cannot control. And they do increase our chances of having emotional distress, which relates to another aspect of mental health care and treatment that I think is really important to understand, that it's a continuum and that it is not a cut and dry, I'm either totally fine and mentally well, or I'm mentally ill. It's really more of a continuum where at one end we might have chronic conditions that are more neurologically based and have more to do with brain chemistry. And so conditions like schizophrenia, other psychotic disorders, major mood disorders like major depression, generalized anxiety disorder, bipolar disorder, all of those are more neurologically based mental illnesses that we consider chronic mental illnesses. Whereas situational stressors are considered adjustment disorders. So meaning that we might have depression or anxiety that reaches problems that require treatment maybe because we're just not functioning well in our life. We just can't seem to kick it, but it's usually related to something going on in the environment. And by the definition of an adjustment disorder, the theory is that if we remove the stressor or learn to adapt to the stressor, then the mood problems or the mental health problems start to diminish. So there's a wide range of, circumstances and stressors in life that can cause emotional distress. And then that might put you at higher risk to develop, particularly if you have a biological inheritance for one of the major mental illnesses. So they all kind of converge, and it's a very, very important for people to understand what their particular biology is, what their particular psychology and environmental stressors are. So that's my job as a clinician, is to help folks ferret that out and not only understand it, but as this next slide shows, come to terms with it and accept it. So,
all right.
You have more to say about that,
Sorry.
Claire?
I was
That's
just
okay.
agreeing. Nope, I was just agreeing with everything you
totally
said.
agree.
No,
Yeah.
it makes a lot of sense. Absolutely. So, if I'm in a situation where I'm struggling with my identity, and that's a psychological sort of condition, and my environment is telling me that I have to be in this type of a identity, but I'm thinking that's not my identity. That's kind of where I feel like I'm fitting in. I feel more comfortable doing something else, but I'm feeling that stressor from my environment to behave a certain way, to look a certain way, to act a certain way, which I feel like a lot of LGBT people can relate to. That can kind of contribute to sort of what you're talking about, the adjustment disorder category, where I'm feeling a certain way and I'm thinking a certain way, but my environment is really resistant to allowing me to express that in a comfortable way. Does that make sense?
Yes. That I think that's a good way of putting it. Yes. So the distress of not being connected, the distress of not being accepted and being other, as is being talked about today, can be a significant impact on well-being and on self-worth and your ability to have compassion
daily
towards
functioning.
Self. Yeah,
Absolutely.
Yeah. So when I'm working with clients, I like to address all aspects. Like I said, I like to be holistic in the kind of mental health care that I provide. And that means that the nice part about that actually means that we have kind of those three big areas, biopsychosocial, of areas to look to see what can we change and what can't we so much, where can we have some impact. And so in terms of biology, that has I lost the word. That implies that we can do things with our body differently to impact our biology. So we're talking diet and sleep and movement and exercise. Those are all things that I like to promote and support people in addressing in their overall wellness. In terms of psychology, that's what, that's really what you think you're coming to a psychotherapist for, right? Is to deal with your psychology, with your personality, with your temperament, with the way you think and feel and behave. And when we're doing that, you can see in this slide that when we're talking about what makes a person tick, both family history and just all of that, we're doing it with an attitude of explaining and not shaming or blaming. And that is a term that comes from the ACEs research and adverse childhood experiences research, where trying to help people understand their trauma and the impact of trauma. We're not trying to blame parents or caretakers. We're not trying to shame anyone, but we're trying to understand. We're trying to be honest. And although it's scary and people need support in learning about this stuff and facing this stuff, we're much more likely to gain resilience and overcome by talking about it with an attitude of compassion. So explain, not shame, is very, very important. And I kind of threw in here on this slide, this is another thing that I tell my clients a lot, is distinguishing between reflection and rumination. So when we reflect, we're thinking about what makes us tick, for instance, maybe when we're working with a therapist or with somebody else that you trust in your life. And we're doing that in a way to gain insights, to gain wisdom, to develop, to develop perspective, to grow. And that is considered a very adaptive, healthy process, compared to ruminating, which is turning a problem over and over in your head like a hamster on the wheel and never getting to any sort of resolution because it's full of judgment and criticism and spiteful tone.
This way, if I would have just said it that way, if they would have said this, if they would have said that, right?
Yes.
Right. And playing a lot of scenarios out associated with those events that maybe didn't happen.
Right.
The what if, coulda, woulda, shoulda. Yeah.
Right. Yeah. So very much in therapy, we are working on helping people to learn how to do this reflection for growth and for change, and not for beating yourself up. Right. And that goes along with explaining and not shaming yourself. So these are kind of important nuances and attitudes about your own mental health and approaching the idea of getting help, which is, the other really important aspect here is that we know that psychotherapy and other treatments too really do work. We do have good evidence that we can alleviate depression, anxiety, risk for suicide, general feelings of well-being, and feelings of stress can all be improved with therapy. So I can't stress it enough. I'm also a stigma buster, because stigma still lives and thrives, unfortunately, and prevents people from getting the care that they need.
Right.
And sometimes at the same time, we also know that seeing a therapist takes time and money, and you're not seeing them a lot usually. So you need people out there in the world, or you might need some critters, and or some fuzzy critters can also provide support and help you to accept yourself as you are.
Awesome.
Yeah. Thoughts on any of that, Claire?
Well, I think it's really important to be kind to yourself. And sometimes that is something that people struggle with. And what I have found, it helps to have somebody that to guide you through that, and reframe some of the experiences that you've had. When you talk about reflection and not rumination, sometimes a lot of rumination will distort past events in the way that we see them. So, for example, if somebody, is exploring their gender identity or their sexuality, and the person that they confide in may not understand what they're going through, or is not a good ally for them, or not a supportive person, that could very easily turn into a very bad experience, right? And what can happen is that rumination, that everybody, if this would have only happened, if that would only happened, and a lot of that blame, right? If I wouldn't have told that person that, what this would have happened. And so when we talk about those kinds of experiences, and sometimes they're good experiences, but some people don't have good experiences when they're on that journey of coming out. I think all of the things that you're saying, finding somebody who is kind of more of a guide away from like the shaming into the explaining, a guide of more into, this is how you reflect on these events rather than how you ruminate on these events. I think is a very powerful tool. Does that make sense?
Yes, absolutely. Yeah. And it's important, it's tricky to find people that you trust, whether that's a professional or a friend. And so having a tribe, having social connections, you don't have to have a big tribe, just a few is really all you need, that you can trust with what's really genuinely going on with you, is so important to everybody's well-being. Connections matter. It's just we are hardwired to be social beings.
Yes.
So actually, that's kind of a segue, because that was another thing I wanted to share here today, is to give some guidance and support and kind of some reassurance that the client, the person, the individual, whatever your reasons for seeking mental health care, you have the right to make informed decisions about providers. And so I thought I'd provide a little bit about just some ideas for helping to kind of narrow that down and make it not seem so daunting. And to start with, I wanted to clarify terms, because a lot of folks don't understand the distinctions between the different types of providers for mental health care. And, no wonder, because you get a lot of different images and a lot of different messages that can be kind of confusing as to who does what. So it's important to know that if you're referred for a psychiatrist, maybe through a family doctor or a friend or something, that provider is really there to assess for psychiatric illness. They're trained more towards the pathology sides of things, or the illness kinds of things, those extreme kinds of disorders. But they treat people all along the continuum, but know that that's their orientation, and they are medical doctors. They go to medical school and specialize in psychiatry, and that's what their job is to provide meds. That's the primary medication, is the primary type of treatment that doctors use. So that's what you get in psychiatry. So people will be surprised when they spend 15 minutes with a doctor and they didn't get any counseling at all, because they didn't understand that that's not the role of a psychiatrist. Then moving to psychology, a psychologist is somebody also with a doctorate. So they go to grad school and they get a PhD, which is not medical school. And so right now we don't have psychologists prescribing, but I know that in the state of Iowa, they were working towards getting some rules changed, some, licensure requirements changed, and some training available so that psychologists could learn the skills needed to prescribe, for the reason of we don't have enough prescribers. And I don't think that's just an Iowa thing. I think that's a national thing. So apart from an emerging role for psychologists to prescribe, a clinical psychologist is one who does counseling. So they do the same, typically the same type of psychotherapy or talk therapy kinds of interventions that I would do, or other licensed at the master's level clinicians, which is what I have, is at the LMHC. So that's the bottom on this slide. That's the bottom type of professional. And I added in that we do have another type of professional that prescribes medication for people needing psychiatric medicine, and that's a nurse practitioner. ARNP is the credential that you'll see. And an example of that kind of a staff is at at Mercy. Mercy Family Counseling on Blair's Ferry has a whole staff of primarily ARNPs, and I often refer there, and I find that they have a good bedside manner. And I tend to kind of prefer to send people to either their family doctor or an ARNP, just by the by is kind of my bias. And then, Claire, you and I have talked some in preparation for our presentation today about the relative risks and benefits of having somebody who specializes. Asking that question: if I'm in the community and I'm finally gonna maybe take the risk of seeing a therapist, don't I need to have somebody who's an expert, somebody who somehow is studied or otherwise highly credentialed or qualified to treat LGBTQ? I have a question mark there. Can you kind of give me your take on that? What do you think, Claire?
What do I think?
Yeah.
Well, I think it's really what the client feels is best for them. That's kind of where my perspective usually lies. If you feel like, if it makes you more comfortable to have a practitioner or a therapist or a counselor who practices from that perspective, that if that's important to you, then that should be maybe on the top of your priority list when you're looking at, what do I want in a counselor, or what do I want in a therapist, right? Because we talked a lot about personal preference, and every person is unique. So what I'm looking for, the techniques or the perspective or the modalities that I'm looking for from a therapist might not be the same as you, right? So I think that that's a personal choice, but that's just my perspective. What would you say is your perspective on it?
Well, I've kind of reflected on this, and for one thing, first of all, I don't know that there are a whole lot of specialists, particularly in our area.
In our area,
yeah,
there's not.
No, so it might be a access thing. But then,
I would agree.
As a person who's been in mental health for a really long time, I also sort of have the perspective that a good clinician should be trained and experienced and have the attitude to serve all people, and that really mental health, psychiatric conditions to adjustment disorders, mental health tends to operate along similar lines for all humans. Now, again, of course, there's individual and cultural contexts that a culturally competent clinician is a must. Whether or not they're specifically trained may not be as important. And that actually kind of is consistent with what I saw in the research. Let's see, is that in the next slide?
From one of the things that I can just speak for social work at the master's level, one of the things that we talk a lot about is self-disclosure. And from a practitioner's perspective, how much self-disclosure we should use. Now, from a client's perspective, that might be something that you need. Like a client may need to know that their therapist has had this experience in their life, and then they can relate. We see that a lot in substance use disorders.
Oh, right.
The client wants to know what the clinician or the therapist experience has been personally or in their family. And we should be trained on how to handle those situations so that it's focused, so it's client focused, right? And not focused on us, because it's not about us. We're there as a guide. Does that make sense?
Yeah.
So I really love the slide that you made. I think it's very good. Can you tell us a little bit about it?
About this particular slide?
Yeah, tell us about this. I love this slide.
Yeah. Well, it kind of speaks to what we're talking about, is whether or not you need an expert specific to your identifying group. I copied a little piece from a study that I looked at about this issue, and this phrase, results highlight the importance of interpersonal connectedness and authentic affirmation as central to the client's sense of mental health and wellness. So basically what that study said was that aspect was more important than anything else, more important than any other technique or theory or specialty. So that fits with what I myself learned in graduate school in the 90s, that relationship and rapport and trust are more important than technique. And that holds, for all groups and all individuals seeking mental health care. That if there is a fit and if there is trust, then that will be a therapeutic change agent in and of itself. So that's important to know and understand. And that also empowers people to be like a consumer, to be, not being the passive or patient without power kind of an idea, that you are in partnership, that you are seeking a mental health provider to be a partner to help coach you, support you, and lead you towards your own mental wellness, not somebody dictating or, demanding or requiring or, So,
all of those things we don't want in our lives.
No.
We don't want anybody telling us how to live our lives, right?
Right. Yeah. Then you're not ever going to want to try therapy again. So I encourage people to take a look at online profiles. Psychology Today is a good place to do that. I have that. I have a slide with that site on there. And I think that some of the words that you might be looking for, some of the reputational, stuff that you hear word of mouth from people, might be things like they're really strengths-based. They don't just focus on everything that's wrong with me, right? Culturally competent is, again, a term that's used to represent people, clinicians who are... I'm sorry.
Can we define that a little bit? What to you, how would you describe what is culturally competent to you?
Culturally...
It's kind of a really...
Yeah, it is. It's big, isn't it? It's kind of a big abstract.
Yeah.
I think it means that you are aware that culture has an impact, and that different cultures have, different sets of rules and traditions and habits that will, in the biopsychosocial model, have an impact on who that person is. And that my culture, when I'm culturally competent, I understand that my culture might be different, and I'm not going to judge that the other culture is different. I'm going to accept it and respect it.
Or the rules of that culture.
And say
the rules of that culture.
Right.
Yeah. Right? Because there's some cultures that require different things of women. For example, women do this and women don't do that, right?
Right,
Which can
right,
be very difficult to manage, can cause a lot of stress if somebody is, coming to realize that maybe, or coming to question their gender identity. And
mm,
here, my culture is telling me, my family, the people that are around me, the influences from my childhood and on up are telling me this is what a, a woman does, and or this is, if I'm making sense.
yes, yeah, 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 yeah,
Yeah, very well said.
yeah. Yeah, and it's, to ferret that out, or to be able to know whether or not a person really is culturally competent, frankly, I don't know how you would do that without some face-to-face interaction,
Hmm.
right? Or at the very least, teleconference. You can't just tell
Hmm.
by what their website says necessarily. But
Right.
word of mouth and networking can be a good way to find folks like that, and realize that most providers are psychiatrists and psychologists might not, but most licensed master's level clinicians are probably going to give you a 15-minute phone call consult, so you can just tell from maybe even a phone call if this is the person you want to make an appointment with. Don't be afraid of that, and don't be afraid of seeing a person once or maybe twice to make up your mind. And I'm not going to care. Masters, clinicians are not going to be hurt if you decide it's not a good fit. We want you to get the best service possible, and have the best match, because most of us do understand that the relationship is the most important part.
Hmm.
Does that make
Exactly.
sense?
Yes, I think I think that that can be very difficult for some people when they start seeing somebody as a therapist. They feel obligated on some level to continue to see that person because they've seen them this many times, or they've already invested in this relationship. But I think I think that the person has to really assess, how do I feel in this session?
Mm-hmm.
Am I, there is supposed to be some discomfort as you go through therapy, um, but it shouldn't feel shameful, right? Or degrading.
Right.
It shouldn't feel, you shouldn't feel guilty after session. And so I think the best practice for clients is to evaluate how they're feeling afterwards. Is this discomfort where I'm sitting in this, I'm going through some of, my muck, and so it's uncomfortable? Or is it, oh man, I really didn't like what they said about, this part of my culture, and I don't think they understand me. You
Mm-hmm.
start having those kinds of realizations, that might be a sign that
Right.
your therapist isn't a good fit. Does that
Right.
make sense?
Yeah, it does. It does. Yeah. 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 So I am kind of reflecting on what we can change and what we cannot. Back to that idea that there are a lot of social institutions, and that comes all the way to the smaller level of the family, to the neighborhood, to the community, to state and national level, that we can't change, particularly by ourselves. And many changes are swirling around us now, um, that hopefully represent a more inclusive society for all people.
Mm.
But to know that with help and support, you can change things internally. You can change core beliefs that keep you stuck in a place of self-hate. You can change your attitude towards your family of origin. Sometimes you need help with that. And we know that change is possible, even into old age. We know that the brain is flexible, and that this is partly why psychotherapy works, is because change is possible at the brain level. And then that can then lead to behavior changes. And all of these things towards healthy living and adaptive living and healthy, compassionate attitude towards yourself and the world really are big ingredients for good mental health. And of course, supports humans, being social animals that we are. We must have at least a few people in our life that give us positive regard, even when we mess up. And that's really what a good therapist does also. We're trained to provide unconditional positive regard, no matter what our clients bring us. So know that that's a very important ethic for really all traditions of mental health providers. What else?
I think I like the perspective of what can you control and what can you not control, and really looking at you know, these are the things within my control. How I move my body, where I go, what I do, versus what somebody else does, or where they go, or what they do, right?
Right.
So
Right.
I appreciate you sharing that. So tell me a little bit about what resources you found here on this slide.
Yeah, well, as I mentioned, in terms of seeking mental health care specifically, I often either get referrals from family doctor or suggest that clients maybe start with their family doctor in terms of medicine, for instance. But a family doctor could be a great resource, especially if you have a relationship already, in terms of referral for counselors. Some physicians get a good working relationship. I have a good working relationship with a physician here in the area that I get a lot of referrals from, and they just have their favorites they like to refer to. So, based on, you know, probably feedback from their patients as to whether or not they were helpful, I think that's how that works.
Right.
That's a good place to start. But also people that you know are, of course, people that you know and trust who maybe have already sought therapy. Are a good place to go. The Psychology Today, I have the website listed there. That is a great resource. It's primarily people who are in private practice, but you can search based on area, based on specialty, based on type of insurance that you take, that you can provide. So you can filter it in a lot of ways. And then you see a picture, you see a bio, you just kind of get familiar with somebody. To me, that's very helpful. I also found in looking at the Lynn County Resource Guide that they actually had a link for resources for sexual health. That was the category, and that ended up being LGBTQ related resources for PFLAG and Cedar Rapids Pride, and there's also a therapist listed there, Kristen Schlomer, I believe, is listed in that resource. And they also have a mental health counseling provider list that's quite long. There's a lot of different agencies that are on that list. So that link is available on this slide too. Another one that I would like to mention, well, there's two other resources that I really want to mention. One is the Olson Family Counseling Center at Mount Mercy University. I cannot say enough about the positive feedback that I have had from both friends and from clients that I've referred for maybe something that, you know, maybe if some family therapy or otherwise have suggested. They seem to do excellent work. They operate on a sliding fee scale. They don't accept insurance, so you can get very affordable sessions, I believe as low as $10. And they have evening hours and Saturday hours. And I think that because they're grad students, they are on the cutting edge of the very best of therapy, and they're very motivated to do an excellent job. So I very much recommend people check out that clinic. And finally, self-compassion and mindfulness is something that I also care a lot about, and hopefully in the future I can bring maybe some more of that specifically to the Wellness Wednesday. But I would encourage everyone to check out Dr. Kristen Neff's site, selfcompassion.org. See it here on this slide. And there you can learn about the research and practices for promoting self-compassion, which is associated with feeling better and better mental health and better wellness. And these are exercises, practices, and mindsets that with help and time, we all can achieve and can have some pretty excellent results.
Well, do you want to talk about what is the last link that you had there? You talked to me a little bit about it before we started, but
yes.
Talking about suicide.
Yes.
Just briefly give a little.
Yeah. Well, it occurred to me that because we hear about in the headlines that there's a higher incidence of suicide for people in the community, I wanted to check into that a little bit. And this publication that I provided the link for seemed to be a very good research document about suicide. And what I saw in that was that we don't have the data on the sexual orientation of people who commit suicide. So we can't say that more in the community do commit. However, they do have data that shows that there are more attempts. And so gay, lesbian, bisexual, both youth and adults, I believe, have more attempts than the straight population. And it also shared that transgender folks have more suicide attempts than even gay, lesbian, bisexual folks. So I think that's important information to know. And again, this is something that we're not going to get better by not talking about it. So it's good that there are organizations and research and literature out there to help guide us.
Absolutely. Thank you. Excuse me. Thank you for sharing that. I think an important point is that stigma, I think we all understand that the stigma against the LGBTQ community is still very prevalent today, regardless. And part of that stigma is not collecting certain kinds of data, which makes it difficult to track. So for example, you're sharing, when we talk about completed suicide situations, that data is not collected. Even though we know with the data with attempts, that the population, the LGBTQ population is at higher risk. I think that there are some safe assumptions to be drawn from that, right? So when we talk about stigma, sometimes things are not just with suicide, but things are underreported or things are left out. And I think there's a community of us that want to bring some of these resources to the forefront in an attempt to crush the stigma. So thank you for including. Thank you.
I'm all for that. Like I'm on that wagon. Yeah. Thank
you for sharing that information. And I want to thank you so much for your time today, Wendy. I know you had a table last year at Pride, at our big Pride Fest. So you are a very very prominent promoter of LGBTQ rights.
Yes,
and
I am.
A supporter.
Yes,
I know that I know that your agency is a safe place for the community as well. And I want to thank you for providing that resource to Cedar Rapids and Lake County community.
Thank you very much.
Thank you for your time.
You're so welcome.
I look forward I look forward to more materials that you bring to Wellness Wednesday.
Awesome.
I think the mindfulness is an incredibly important piece when we talk about anxiety and depression.
Mhm.
So thank you so much.
Sure.
Thank everybody out there for
Yeah.
joining us, whether you're watching this now or 5 years down the road. I hope that you found some resources and some information. And if you have any questions, please reach out to either of us. Have a wonderful day.
Thank you, Claire.